Hello and welcome to EUFOREA TV Breaking News. My name is Dr. David Bull. I'm a medical journalist and I'm thrilled to be your host for this, our first show of July 2021. In this show, we will be looking at the unmet needs in chronic rhinosinusitis care from a patient perspective. In a minute, I'll be talking to the co-chair of the EUFOREA Patient Advisory Board, Dr. Thijs Teeling. He's also honorary chairman of Task Force Healthcare in the Netherlands. Then we'll speak to Elizabeth van Stayen. She is marketing and communications specialist at EUFOREA. Chronic rhinosinusitis, or CRS, is a symptomatic chronic inflammatory syndrome of the nose and paranasal sinuses, and it affects up to 10% of patients in the Western world. About 1 out of 3 of these cases are accounted for by chronic rhinosinusitis with nasal polyps, or CRSwNP. CRSwNP is often difficult to treat, is a complex disease, and it has long-term morbidity. But, as we reported in March of this year, the advent of new treatments like biologicals looks like very good news for sufferers. But those aside, current treatments such as corticosteroids and even sinus surgery are often ineffective, and there is an urgent unmet clinical need to improve care for CRSwNP. Well, to tell us more about the often unmet clinical needs from a patient perspective is Mr. Thijs Teeling. He's honorary chairman of Task Force Healthcare in the Netherlands. He's also a member of the International Advisory Board of the Master of Science Programme in Global Health and co-chair of the EUFOREA Patient Advisory Board. Thijs, it's great to see you. You have many titles.
Thank you very much, Dr. Bull. David, this time, yes, but after these titles, I'm here as a patient. And as a patient, I'm also active in this EUFOREA board.
And that's a really good point to make. So as a patient, why are you so excited about the outcomes of the EUFOREA Patient Initiative then?
Well, you see, polyps, they are a real burden. And the Patient Initiative of EUFOREA provides novel insights on the underestimation of the burden of this chronic rhinosinusitis with nasal polyps and the shortcomings of the current care. There are multiple recommendations made by the patients, and they can underpin action plans for implementation of better care for the chronic rhinosinusitis with nasal polyps among all physicians treating patients with this disabling disease.
So let's then look at those unmet needs. What do you particularly like about the Unmet Needs initiative of EUFOREA? Because I've seen many graphs now that have been presented to me really highlighting what those unmet needs are and also the solutions to them possibly.
Yeah, especially the term unmet needs is really with something which is underlined, I would say. Well, patients in these reviews, they can share their burden of the disease and also their frustrations related to polyps treatment, which means that you realize you're not the only one with these problems. But also patients can share their experiences with alternative treatment options, shortcomings of the current care pathways, and especially recommendation for improvement of care.
And from all of those interviews, from what I've seen, there were some really big messages about improving care for patients with CRSwNP. I mean, I particularly like the idea that people can say, I'm not on my own, there are many others affected by this. But can you just highlight some of the big messages that came out of those patient interviews?
I think if you look at it, the treatment options with the oral corticosteroids, those are difficult words for me as a non-English speaker, and or sinus surgery, they both have positive, but also a lot of negative aspects, and including the lack of long-lasting efficacy. I know that from my own personal experience, I suffered a lot in those cases. And I believe, and we as the patient group believe, that better coordination of care, more patient-centered care, and greater public awareness increases the research on the disease mechanism and probably better therapeutic options, and they would be warmly welcomed by all the patients.
So Thijs, tell me, why are you involved? Why did you get so involved in this patient initiative?
When I was a child, in my childhood, I always had a runny and stuffy nose. But those days, that was considered as part of the childhood. Later on, I visited several doctors, but even after different medications, several surgeries, my problems remained. And I had decided, okay, I have to live with these problems. But it became worse, and I lost my smell. But fortunately, 10 years ago, I was referred to an ENT doctor who had a successful approach. And after 50 years of suffering, I'm now free of all my problems. This means a tremendous improvement of my quality of life. And when I realized that the European Forum for Research and Education in Allergy and Airway Diseases is a group of professionals who share the appropriate treatments, I decided to give my support as a patient with the intention and the hope that other patients might also give better treatments and have a better well-being.
Well, that's really, really great of you, and I'm so thrilled that your symptoms are so much better. Thank you very much indeed, Thijs Teeling.
Thank you very much, David.
Well, joining me now is Elizabeth van Stayen. She is Marketing and Communications Specialist at EUFOREA, and she liaises with the patients of the Patient Advisory Board to ensure that their voices are heard. Elizabeth, it's really good to see you yet again. Now, I've obviously just spoken to Thijs Teeling as a patient, but from your perspective, why are you so excited about the EUFOREA Patient Initiative?
This is a very exciting initiative for EUFOREA because it's really the first time that there's really been an international patient initiative undertaken to bring attention not only to the physical burden of CRSwNP, but also on the emotional and even the financial burden of the disease. And we believe that when patients are included in the conversation, then physicians can better educate patients about the diagnosis and prevention, and also to really raise awareness among policymakers about a disease that, despite being in 2021, that is still underestimated. So we're very grateful to the members of the EUFOREA Patient Advisory Board who have been so open in sharing their disease journey.
I find it extraordinary, actually. I work across many different medical fields, and I find it extraordinary how infrequently patients are actually asked about their own conditions. And I think you're absolutely right there. It definitely has highlighted the unmet needs, hasn't it, of those patients with CRS?
Yes, so it certainly has. So we've heard so many stories from patients whose shared experience have really highlighted the immense impact that chronic rhinosinusitis with nasal polyps had on their daily life, and aspects that are so often misunderstood. So from being unable to enjoy the flavors of a meal with friends, or even being unable to detect immediate threats to their personal safety through a gas leak or something like that, due to the inability to smell, or just feeling like you have this unrelenting cold that never quite goes away. So it's essential that we continue to bring awareness to the disease in society so that physicians can continue on the path to delivering the best care.
So obviously outreach to the community is really important for EUFOREA. So what actions are the team now envisaging in terms of making sure there is more reach out to that community?
Mm-hmm. So EUFOREA is going to be launching a continuation of this initiative, which we hope will aim to identify the unmet needs of other atopic diseases as well, so asthma, atopic dermatitis. And we hope that by generating more patient feedback for a variety of disease areas, that healthcare providers and policymakers can continue to apply these learnings to improving patient care.
So for you, this is really about making sure that patients are really empowered, and I guess that's where EUFOREA comes from in this.
Absolutely. So EUFOREA, patients are at the center of everything we do, and we actively foster dialogue with patients who have chronic respiratory disease. And we really think we work with patients and for patients to educate them about not only prevention and diagnosis, but also the referral and correct use so that they get the right treatment at the right time. And we're excited to see where this initiative takes us.
Well, it's really important work, and it's been absolutely wonderful to talk to you yet again, Elizabeth. Thank you very much indeed, Elizabeth van Stayen.
Wonderful. Thank you, David.
Well, that's it for this edition of EUFOREA TV Breaking News. Many thanks to my guest, to Mr. Thijs Teeling, and also to Mrs. Elizabeth van Stayen for truly fantastic insights. It was really brilliant to see how involving patients really does make an impact and really does change care for the better. Now you can find more information about EUFOREA and also register for the EUFOREA meetings on the euphorea.eu website, where you can also sign up to receive the latest news via email. You can also follow us on Twitter. The address is @EUFOREA. But that's it for this show. See you soon, and thank you for watching.